The Birds and the Bees, Group 18, Unintended Pregnancy.
The target behavior we're going to be studying today is going to be parents having to talk with their adolescents about practicing safe sex. According to JAMA Pediatrics, adolescents who have had the sex talk with their parents are more likely to use condoms and birth control, and they have also found the link between parental communication and safer sex practices strongest for girls and teenagers who have talked with their mothers. According to the CDC, about 50% of high school students have engaged in sexual intercourse, with 60% of that population reported using a condom and 14% reporting not using any form of contraception. Though we have seen a steady decline since the early 2000s, the rate of teen pregnancy in the U.S. is still substantially higher than any other Western industrialized nation. One of the models we're going to be using today for our project is the input-output model by William J. McGuire. Our source is going to be our group in collaboration with Planned Parenthood, the CDC, and the San Diego Unified School District. Our message we'll discuss later on in the PowerPoint. Our channel in which we will share our project is going to be through Facebook and other print media posted throughout the school. Our primary receiver is going to be parents of 9th or 10th grade high school students, whereas our secondary receivers are going to be 9th and 10th grade students. Now, our overall goal or destination will be to prevent the unintended pregnancies among teens in the San Diego Unified School District. For our product, it will be parents discussing safe sex practices with their 9th and 10th graders. The price they will have to pay, or in other words, the changed behavior, will be lowering the chance of an unpredicted pregnancy amongst 9th and 10th grade children. Our place ideally will be the high school office, a doctor's office, Facebook ads, anywhere basically parents are going to be seeing these pieces of media. And for our promotion, we'll be promoting on social media and print media.
Using McGuire's inputs, we developed the 5 main components to frame our campaign. We will be in collaboration with our sources, which are Planned Parenthood, the Centers for Disease Control and Prevention, and the San Diego Unified School District. We have developed 3 messages that we will further discuss later in the presentation. To effectively get our messages across to our audience, we will be using Facebook and print media as our principal channels. Our primary receivers are parents of 9th and 10th grade high school students. Our secondary receivers are high school freshmen and sophomores. The overall purpose of our campaign is to prevent unintended pregnancies among these teens in the San Diego Unified School District.
The primary audience is parents of 9th and 10th grade students. Primary audience segmentation includes 35 to 45-year-old male or female who make $42,000 to $62,000 a year. They hold a bachelor's degree or higher, they can be single or married, and have children in high school. They preferably live in San Diego, California, in the 619-858 area code. We want parents who want to trust their children when engaging in sexual activities, parents who want to have an open relationship with their children, parents who are too young to be grandparents, and those who have social media accounts but mainly use Facebook. The benefit sought is fear reduction. Meet Angela. She's 42 years old and makes $48,000 a year. She holds a bachelor's degree and works an office job. She's married and have 2 children ages 14 and 16. She lives in San Diego in the 619 area code. She wants to have an open relationship with her children but is uncomfortable talking about sex with her kids. She believes that her child is not having sex because he is only 14 years old. The only social media that she uses is Facebook.
Our secondary audience are 9th and 10th grade students. Our secondary audience segmentation demographics are 9th and 10th grade high school students, male and female students, and students of all races and ethnicities. Our geographic region is San Diego, California, with the area code 619 or 858. The psychographic segmentation are students that are beginning to date, students that have curiosity about physical attraction and sex, have open conversation with friends, use Instagram, Twitter, and Facebook for social media, and lastly, students that watch Netflix and Hulu. The benefits sought are fear reduction and gaining knowledge. Our secondary audience persona is Riley. Riley is a 10th grade African American student at San Diego High School. He plays on the soccer team and he is an honor student. He spends a lot of time on Twitter and Instagram. At school and on the weekend, he likes to hang out with his friends and his girlfriend, who he has been dating for 3 months. Riley and his girlfriend's relationship is beginning to develop, and they are beginning to have more physical interactions.
We will have 2 channels. Our first channel is social media, and we will be using Facebook because this is most likely to be used by the parents in this age group. We will have our flyers and posters shared as ads on Facebook, as well as a page detailed on the next page that will be liked by the parents that will frequently show our content. Our second channel is print media, and we will be posting our flyers in doctor's offices, in the school office that their child attends, and other places that the parents might see them frequently. The kids can either bring to their parents or that the parents will see in places like the grocery store.
As stated before, one of the channels that we will be using is Facebook. On this slide, you can see an example of the Facebook page that we plan to use that has the cover page being a picture of birds and bees and the name of our program in the icon. Facebook is a popular channel for parents and even for some of their children, so it is easily accessible for them. The Facebook page would allow members of the group to post and seek support from other members and support from us. As creators of the page and the program, we will be posting resources for not only the parents, but even if their students have questions, to where they can reach out to us, find support groups, and find other things about our program and where to seek help if they need it.
We also developed flyers for the parents to view that we think will encourage them to either inquire more or to actually initiate the conversation about sex with their child. Each of these flyers will be the ones that are posted on the Facebook page and the Facebook ads, as well as posted on the locations that we mentioned previously that we think the parents will view. Each of the posters has a phrase that we think will be attention-grabbing, as well as either statistics or resources for the parents to view so that they can talk to their child about sex and preventing pregnancy. These resources are the CDC and Planned Parenthood. Our first message is that you're too young to be a grandparent. 41% of high school students are having sex, so talk to your child about responsibility. The heat and light elements are present in this message. The light comes from the statistics, but the heat comes from the targeted emotions of telling the parents that they are too young to be grandparents. The message is gain-framed by emphasizing the benefits of having a talk with their child. And finally, this message uses the central root because they are portrayed with meaningful statistics and distributed in clinics, nurses' office, and well-known health agencies. Finally, our objectives are to advise on the benefits of talking to your child about sex and to activate a conversation.
The second message we have is get awkward, talk to your teen about safe sex. The objectives are to announce and activate. This is a light component because it is content-based. Parents would need to visit the website to get more details about having the talk with their children. This is gain-framed because they would provide benefits of having the talk with their teens when it comes to teen pregnancy. And this goes through ELM's central route as parents get to thinking about how awkward the talk is, but also how important it is to keep their kids from getting pregnant. The last message we have is condoms aren't the only thing that prevent unintended pregnancy. Try conversation today. Again, this uses announce and activate. The message is light because of the logical aspects. Condoms are a good start for prevention, but there are other ways to prevent pregnancy. This demonstrates the central route because parents are already engaged in trying to prevent their teens from getting pregnant and will eventually visit the website for more information to try and prevent unintended pregnancy.
As far as our program evaluation and to improve program design and implementation, we have developed process, outcome, and impact SMART goals. Our process SMART goal is to increase the rate of parents that talk to their children about safe sex and safe sexual practices by 20% at the end of the first semester of the student's freshman year of high school. Our impact SMART goal is a 20% increase of safe sex practices among freshman students during the end of their sophomore year of high school. And our outcome SMART goal is a 25% decline in pregnancy rates among freshman and sophomore high school students in the San Diego Unified School District. We also have 2 evaluation measures that will let us know the success of our program. One is to conduct an entry and exit survey for freshman and sophomore high school students to measure if the parents have talked to them about sex. And 2 is to conduct an entry and exit quiz for freshman and sophomore high school students to measure if they have gained more knowledge regarding safe sex practices and topics.